What are the symptoms associated with specific types of anxiety disorders? I've said in my previous video, which I've linked down below, that there are different kinds of anxiety disorders, each with their own symptoms. An individual may have more than a single anxiety disorder as well. I'm going to break down some anxiety disorders and the potential symptoms associated with them. To first understand, you should get a basic idea of what agoraphobia is. A very basic definition is when one is scared of leaving the comfort of their own home, going outside into potentially dangerous places which might be crowded or open. It's thought that agoraphobia accounts for 60% of phobias. And I will do a more comprehensive video on agoraphobia in the future, so please be sure to check back. Now, I will get into different anxiety disorders. Panic disorder without agoraphobia. A panic disorder without agoraphobia affects individuals who have random and unexpected panic attacks. It can also affect people who have fears of panic attacks, heart attacks, losing control, or going crazy. Behavioral changes may occur due to the panic attacks. Panic disorder with agoraphobia. I've given you a quick definition of agoraphobia, and this panic disorder can leave someone unable to leave their own home. The treatment method for those with and without agoraphobia differ, so proper diagnosis is essential. Agoraphobia without a history of panic disorder. Agoraphobia, it can strike people who do not have a prior history of having panic disorders. It can happen due to life experiences, fear, trauma, or other reasons. Someone with only agoraphobia will present a fear of public spaces, outdoors, and being in an unfamiliar environment. Specific phobias. Phobias fall into 5 categories and are considered irrational if they alter or affect behavior in an inconsistent way. The 5 categories of phobias are fear of nature, natural environments, storms, heights, water, fear of animals, fear of physical danger, injury, blood, fear of situations, flying, driving, and other fears. Social phobia. Social phobia, it's a fear of being in social situations. It can encompass extreme self-consciousness, including the fear of being watched or judged in what most consider trivial situations. People with social phobias may have extreme shyness, low self-esteem, and zero confidence to perform in social settings. Obsessive compulsive disorder, OCD. OCD can involve being obsessive, having compulsions, or both. An obsession is a behavior that you cannot shake, such as a fear of germs, receiving harm, losing things, and being extremely superstitious. Compulsions may include constant cleaning or washing of yourself or items, arranging or rearranging, hoarding, counting, tapping. Any of these actions repeated compulsively can qualify as symptoms of OCD. Post-traumatic stress disorder, PTSD. PTSD usually results from a trauma, but in rare cases can occur because of someone else's traumatic event or by thoughts of a traumatic event. PTSD sufferers may experience flashbacks and memories linked to the trauma and can experience feelings of intense distress. They usually avoid situations which may lead to a similar trauma. They can also develop a higher baseline of fear so that small changes can trigger a reflex. PTSD also causes other issues such as loss of interest in their future and present, detachment, and emotional numbness. Acute stress disorder, PTSD, is only diagnosed after you've had the symptom for 30 days, and ASD may be the beginning stages of PTSD. Symptoms occur right after the traumatic event, causing someone to initially be ASD. There's generally more emotional disconnection, numbing, depersonalization, as well as dissociative amnesia. Anxiety disorder due to medical condition. This is a bit different because it's not your medical health, but a medical condition which is causing it. For example, having thyroid issues can cause sudden and extreme anxiety. Substance-induced anxiety, it's caused by a stimulus, substances, both legal and illegal. Sometimes the drugs themselves do not cause your anxiety disorder, but rather exacerbate it. Generalized anxiety disorder, GAD, is persistent, often daily, and that's anxiety without any cause. It can be used as a diagnosis for people who have anxiety without other symptoms or disorders. The symptoms tend to be milder unless you qualify for another diagnosis. Anxiety disorder, not otherwise specified, NOS. This is diagnosed when there are symptoms of an anxiety disorder, but no clear cause, and may include depressive disorders. People diagnosed do not qualify for a specific diagnosis, but may have the physical and emotional symptoms of anxiety. As you can see, there are several different types of anxiety as well as various symptoms. If you'd like to find out more about anxiety symptoms, you can check out our website, anxietyboss.com, by clicking on the link in the video here, or by clicking on the link below. You may also be interested in our anxiety test to see the level of your anxiety.